Our remittances are a major source of capital inflows for developing economies around the world. Just last year, for example, total global remittance flows exceeded $550 billion. That was an entirely new record. But obviously, this COVID-19 pandemic has other ideas. It's actually forecast to trigger the sharpest fall in remittance flows in recent history, worse even than 2008, as economic activity and travel essentially grinds to a halt. From Mogadishu, CGTN's Abdulaziz Pileno explores how this pandemic has affected nearly 40% of Somalia's population, who rely on remittances to survive.
At this sprawling neighborhood in downtown Mogadishu, it's business as usual. Remittance companies have opened their doors to allow families to receive financial support sent by their relatives living abroad. However, despite having one of the region's highest coronavirus infections, remittance companies locally known as hawalas remain operational, allowing millions to access funds critical to their survival. But there are concerns that the global emergency will affect the flow of cash that is a lifeline to many.
Over half of the money that we used to receive from abroad has been reduced because these Somalis, those who are living in Europe or USA, or any Somali expatriate who is outside Somalia, was not able to send money.
World Bank estimates that $1.4 to $2 billion is sent back to Somalia annually by expatriates living mainly in the US and Europe, funds that support more than 40% of the country's total population.
Because of these problems and the lockdown imposed by the government, so many Somalis were unable to send money to Somalia, to their families in Somalia. So we can say that COVID-19 is having or causing huge disruptions to the remittance industry.
Across the globe, thousands have died from the infectious disease that has forced governments to take drastic actions, including total lockdowns, flight restrictions, and cessation of movement in some countries. Research indicates that Somalis living abroad are dying from COVID-19 at an alarming rate. Analysts attribute it to low income, poor living conditions, and cultural practices.
A large number of Somali families entirely depend on the remittance industry. Because of the lockdown and because of the lack of remittance companies operating for the last 3 months, definitely these families will suffer a lot, as they will have difficulties in paying the school fees, paying the rent, and even they will not be able to manage to buy food and whatever they need, including the essential goodies.
Somalia has more than 1,000 confirmed cases of the coronavirus and more than 50 fatalities. Public places, including mosques, remain open as worshippers observe the holy month of Ramadan. The month-long fasting period culminates with Eid al-Fitr, also called as the Festival of Breaking the Fast, a religious holiday celebrated by Muslims worldwide that marks the end of the month-long dawn-to-dusk fasting of Ramadan. And with no sign of a possible vaccine or treatment, many will have to abandon this year's festivities, with experts predicting a shortage in critical cash flows. Abdulaziz Pileno, CGTN, Mogadishu, Somalia.
A team of Chinese medical experts has landed in Algeria to help the North African country deal with COVID-19 over there. During their 15-day stay, these experts will share a range of experiences in dealing with COVID-19 with their Algerian counterparts. The medical team of 20 individuals specializes in a broad range of areas, everything from respiratory ailments, intensive care, infectious diseases, and even